you have a friend who wants to know which drugs he has available as alternatives to Viagra? My name is Eduardo Garcia Cruz, I'm a urologist, and I've been working with men with sexual issues, specifically with erectile dysfunction, for more than 15 years. And in this video, I'd like to tell you which alternatives to Viagra you may find interesting and useful to treat or improve your erection. So Viagra is the commercial for Sildenafil. Sildenafil is a PDE5 inhibitor, and in this family of PDE5 inhibitors there are many more alternatives. We have Tadalafil, we have Vardenafil, we have Udenafil, we have Mirodenafil, and we have Vardenafil. In Spain, so far, we have 4 of them. We have Sildenafil, Tadalafil, Barnaclínica, and Avanafil. But which are the differences between these different drugs? We have Sildenafil. It takes more or less half an hour from the intake to the action, and more or less 1 hour until the maximum serotonin concentration. And Sildenafil is able to last for more or less 6 hours in our bloodstream, so it will be useful for you, it will be effective during these 6 hours, more or less. Vardenafil, the most well-known commercial would be Levitra, is a drug which is akin to Sildenafil, to Viagra. It takes more or less 30 to 60 minutes from the onset of action, and it lasts for 6 hours. Unlike that, we have Avanafil, which would be Spedra, and Spedra, it takes more or less 30 to 60 minutes to work, but the length of action, the duration of action would be slightly longer, arriving more or less to be efficacious after 10 hours of the intake. As a difference between Avanafil and Vardenafil and Sildenafil would be that we know that Avanafil, Spedra, has less side effects, although in some papers, in some research, it has been shown that might be slightly less effective. So my standpoint with this drug would be, I wouldn't use Spedra as my first choice, I wouldn't use Avanafil as my first choice. What I would do would be to use any other PDE5 inhibitor, and if it works, but the man has side effects, then I would immediately switch to Avanafil to try to diminish these side effects, okay? And last, we have Tadalafil. Tadalafil, the most popular brand is Cialis. This drug is slightly different because you can take it on demand or you can take it once a day. You can daily take this pill. But on demand, how does Tadalafil work? You take it and it takes more or less between 1 hour and 2 hours to make it to the bloodstream and be effective. But the main difference is that it lasts for 36 hours. So it's called the weekend pill because you take it on Friday and it's effective until Sunday. And that makes us to use it in a different way. For example, if we have somebody who cannot anticipate when he will be having sex and wants a drug that works really, really fast, then we would go for Sildenafil or Vardenafil. If we can plan the sexual relationship, or we guess that we will be having more sexual relationships more or less in the same time, then we would go for Tadalafil. Tadalafil, as I was commenting before, you can also take it daily. So instead of taking 10 to 20 milligrams on demand, you can take 5 milligrams every day. So what it does is that it's always active. It takes more or less 4 days from the first take, from the first pill, until it is fully effective. But after these 96 hours, you take it every day and you'll have the drug, working all time. So if you're in a sexual environment or in an erotic situation, you won't be forced to take, to stop and take the pill and wait for some time. So it's already in you, so you will experience much faster erections. These are, generally speaking, the alternatives we have to Sildenafil, to Viagra these days. Other drugs, other PDE5 inhibitors such as Udenafil or Mirodenafil, etc., are not available in Spain, but still they have more or less the same characteristics, the same features as Vardenafil, Avanafil, or Sildenafil, so with minor differences. But you can more or less interchange that and they work nicely. Regarding efficacy and side effects, which is something that many men are worried about, more or less these drugs work in 75% of men. Doesn't mean that work everybody 75% of time. So if you take the pill 4 to 8 times and it's not working, it means that it's not effective on you, so you should be changing the drug. But 75% of men get to have normal erections when they use the drugs. Those men who are less likely to have good erections with the drug are those with diabetes, those men who have been operated because of prostate cancer or bladder cancer or radiotherapy, or those who have severe erectile dysfunction. So if your spontaneous erection is not enough to achieve rigidity, so if you only feel enlargement or engorgement but the penis does not become rigid, then you're at high risk of these drugs not working. And regarding side effects, they are mild in nature. The chances of you dropping off the drug because of side effects is something like 1 in 20, so these are pretty safe drugs. And the most common side effects would be headache, stomachache, muscular pain, and flushing. Feeling hot and getting red, which is something that might be kind of worrying, but it's really not an issue. You're not having a stroke, it's just that these drugs induce vasodilatation and you're experiencing this wave of heat, but really very safe drugs. I hope this video was useful. If you enjoyed it, please hit the like button and subscribe, and hope to see you soon. Bye.